Greetings from my back patio. Keep looking for places to do work and also to be comfortable while I do it. So today it's the back patio. I will tell you that working from home the last couple of weeks has been a challenge for me. This is my home. For me has always been my haven, and so I prefer to do my working out and work from work. I'm a person who rarely brought work home. I tried to stay at work as long as I needed to do to get my work done. And so this has been hard for me. And so I really have an appreciation for those of you who've been forced to work from home. I know that finding a comfortable place to work and trying not to be distracted, you'll hear birds in the background, is challenging. And so whatever we can do to help you through that, please let us know. We want you to feel productive and capable of doing your work from home. So we'll start the presentation. I am finishing up my 2 weeks of quarantine this week, so I should be back in the office next week, barring any further unforeseen COVID issues. So we should look forward to that next week. All right, we'll move on. July is Black and Indigent People of Color Mental Health Month, and so formerly known as Minority Mental Health Month. And so we do want to acknowledge that this month, particularly in light of everything going on in the country and the world today. And one of the things I wanted to point out with this is, how does COVID impact people of color? And so there was some research done in the Crisis Text Line, and the Crisis Text Line is a nonprofit that provides free peer counseling via text, and they've seen a dramatic spike in users during the COVID pandemic. And what they're seeing is African American texters mention a recent loss of a loved one, which is almost twice as high as the average texter, 14% of the time. And 20% of the time, Asian Pacific Islander texters mention having recent experiences of racism and or discrimination, which is more than 3 times the average texter. And then 46% of Hispanic, Latino, or Spanish texters mention current financial issues. And so we really need to focus on these issues as we move forward, and recognize that the people we serve and our staff are needing extra supports right now, and we need to help provide those. All right, on to COVID. I will tell you, in the beginning of the pandemic, this was a website I accessed frequently, probably a little too much. But I don't access it as much anymore. I've kept it in this presentation because I think it's important to get the global perspective. So we now have over 13.5 million individuals with COVID across the world, and that's known COVID, and about 585,000 deaths. And then in the United States, we're now right at 3.5 million cases of known COVID and over 137,000 deaths. So what I've really been focusing more is what's going on in California, and more importantly, what's going on in Fresno County. So in California, through it's actually been a couple of days ago, they're a little behind, about 336,000 cases, over 336,000 cases, and 7,000 deaths. And that is, of course, continuing to go up, a little less than last week. So that's good. But we are still seeing that high overall positive test rate in California. So it had been running around 5%, a little between 5 and 6%. And we know from the World Health Organization that if you want to get control of a virus or a pandemic, you need to keep the incidence of it less than 5% at any given time. So in California, that's inched up to over 7%. And I'll talk about it in Fresno County in a minute. This slide looks a little different, the Fresno County numbers, and that's because the Department of Public Health, quite frankly, is overwhelmed with cases right now. And so keeping up their daily website, they've decided to go to Tuesday and Friday updates. But on the state website, which is what you see here, it is daily reported. So the information you'll see on here is a little different than the Fresno County website. That'll get updated tomorrow. But through yesterday, 8,941 cases and 91 deaths in Fresno County. And we have a percentage of just under 12% right now. So while I mentioned in the prior slide that the state overall is over 7%, we're closer to 12% in Fresno County. And remember to stay off the state watch list and get out of these closings we've went through. We have to get under 8%, so we're not there yet. The next slide will show the hospitalization trends. Last week, I reported out that we had 172 individuals hospitalized. That's up to 219. And for both of those numbers, you'll see on this slide, on the left-hand side is positive patients, on the right-hand side is suspected. For a while there, the suspected was going down a little bit because the testing was turning around quickly. Because of the number of cases, our testing has become problematic again. And so you'll see that number go up a little bit as it's taking a little longer to confirm or rule out COVID. But anyhow, comparing apples to apples, a couple of weeks ago, it was 129 hospitalized confirmed. Last week, 172. This week, 219. The ICU, it comes up a little slower because not everyone who gets hospitalized gets put in an ICU bed. And so that went from 33 to 40 to 44. Probably the bigger concern, last week I reported that over the 2-week period, even though the number in the ICU went up and the number in the hospital went up, the number of available ICU beds stayed about the same at 74. Right now, we have 56 ICU beds available. So we've had an increased need in ICU beds even beyond COVID, as evidenced by the number of people or the number of ICU beds available. And then our watch list information, and this is the rolling 14 days that the state's looking at in determining what counties are put on the watch list and when might you come off. So we're not looking good here. Our deaths over 14 days have increased. Our numbers tested has increased, which is good. That's one of the parameters, but our positivity has also increased from 11.3 to 11.6. So on this slide, what you want to see is deaths decrease, numbers of people tested stay up at least at 1.5 per thousand population. We're at 2.3, so that's good. But get our positivity under 8%. And again, right now we're not there. All right, next slide. I wanted to talk just a little bit about immunity. Obviously, with my family situation where we've had someone who was diagnosed with COVID, and by the way, he's doing really well. He's off isolation. He had some symptoms early on, mild fever, real low fever, some aches and pains, some fatigue. He did lose his sense of taste and smell. It's coming back a little bit. But that was really all of his symptoms, and he's pretty much fully recovered now. Still a little bit of loss of taste and smell. But you know, one of the questions I get asked, and one of the things I'm curious about as a mom is he okay now being out, or could he get it again? And if he got it again, is the chances that he has a little bit of antibody, does that bode well for him, or will it be worse? And the bottom line is we do not know at this point. There are a number of studies that have been done in the very early stages of validating the research, but some people do continue to test positive even after the isolation period and recovery. This is why, and let me talk a little bit about isolation and quarantine. So if you have a confirmed positive test, you are put in isolation. And that means you can't be out and about. You have to isolate from even people in your own family, in your own household as much as possible, have a mask on, wash your hands, all those things. But pretty much stay in one room as much as possible. And then you have to stay in isolation at least 10 days from the time that symptoms are first developed, and you have to have 3 days without a fever not using medication, and other symptoms improving. And so it could be within that 10 days, as it was for my son, or it could be beyond 10 days if you remain with a fever that needs to be controlled by medication, or you have other symptoms that are not getting better. And so that's the isolation for COVID positive. If someone's asymptomatic and they test positive for COVID, you still have to be in isolation, but it's 10 days from the positive test with all and no development of symptoms or things like that. People like me who were exposed to a positive person, and remember, the exposure that counts, that gets you the joy of quarantine, is you were within 6 feet for longer, 15 minutes or longer, without masks. And for me, that was giving my son a ride in my car. And so because I was exposed to him, now I have actually a longer period of isolation, if you will, but it's called quarantine. And in the quarantine, very similar to isolation in terms of you actually can go to the grocery store if you wear a mask and such, but you're basically supposed to stay at home and wait and observe for any symptoms. And because they think there's up to a 14-day period before you might develop symptoms, you have to do that for 14 days. Once that period of time has ended and you haven't developed symptoms, then you're considered out of quarantine. And so that's those periods of time. But some people who actually test positive for COVID, they can test positive even after they've met that criteria for coming out of isolation, whether it's 10 days or 10 plus 3 or what have you. And so they're at this point, they think those continual positive tests, particularly when they're not accompanied with symptoms, they're not infectious. They don't believe. They think that what's being picked up or measured in the COVID test is the viral RNA, which is a part of your DNA. But they don't think it's active virus that's infectious. However, there have been instances where people have either tested negative and then later tested positive again and had symptoms, as well as people who just don't seem to recover for some period of time with COVID. And so those are the pieces that call into question, will you get immunity? That antibody test that lots of people ask about, which would be evidence of immunity. It says that your body has developed antibodies to the virus and can fight them off with those antibodies. And if so, if you get those antibodies, does it protect you from getting the virus again? And if it does, for how long does it? And those are things we just don't have enough information to know right now. And so that's kind of that uncertainty that makes it so important for us to follow those precautions, even if we've had COVID. And so I'm going to talk about that in a minute, which is now. So in terms of what we're doing, nothing's really changed, only bringing people back to work based on a critical business need. Ensuring staff safety by limiting the number of people in work, making sure that the work environments are safe. You know, we've had all of the air filters upgraded in our buildings, and we're looking at workstations and all of those things. We have signage, etc. We've talked about this before. We are looking at our remote health screening, and the county's looking at automating that somewhat, and so we'll be reporting out on that in the weeks to come as that improves. So again, though, I can't emphasize enough how important it is, if you are coming to work still, and even if you're not, stay home when you're sick. If you feel funny, off, not right, you really, or if you've been exposed to someone, you really need to stay home. Even if you're working from home, don't be going out and about. Don't get together with family and friends if you're not feeling well. That's really how we think COVID is being passed on. And so take that time off, trust that we'll manage without you, and stay home if you're sick. And then if you are coming to work, and I apologize, Brian, I keep moving through the slides without telling you. If you are coming to work, this is slide 13, stay apart from your coworkers. I think people have kind of come to rely on the mask as if you have a mask on, you can kind of do anything. And that really couldn't be further from the truth. The best line of defense is to never come in contact with COVID. And the way, the one way that we do that is the stay-at-home orders. When we have the stay-at-home orders, we thought that if people stayed at home and didn't interact with one another, we could stop COVID in its tracks. That wasn't successful for a variety of reasons. And so if we're going to be around each other, whether it's going to the grocery store or around family and friends, staying at least 6 feet apart, further is better, is your best means of not getting COVID. Washing your hands, all of those things, not touching your face. The mask is the last line of defense. This is if you can't maintain that distance, if you have to be close to people, hopefully just for brief periods of time, the mask will help prevent you from giving someone COVID, and they're even starting to keep you from getting COVID. But when you're at work or even outside of work and out in the public, don't rely on the mask to protect you from COVID. Don't rely on the mask to allow you to hang out in closer than 6 feet for long periods of time. It's not reliable to protect you in that regard, especially a cloth mask. Still maintain that distance. And in the work setting, I know it's really easy to become complacent. These are your coworkers. You've worked with them for years. We've gotten through this far in the pandemic and no one's gotten sick. Well, that's where we're finding some transmission occurring. People are taking off their masks, hanging out in a cubicle, or standing close to one another, eating lunch together without maintaining that distance. And we're finding across the community that's what's happening, and it's spreading as well. And so you can't become complacent. You've got to treat your coworkers like strangers as far as it relates to the virus. What that means is even when you're at work with people you know and love and have been working with, stay apart from them and have your mask on, but don't rely on the mask to protect you in long periods of time. And so don't meet in enclosed spaces for 15 minutes or more, even with a mask, and don't take your mask off when you're with your coworkers because you trust them or you know them or nothing bad has happened. That letting down our guard right now is the worst thing we could do. So we really need to maintain that guard and we love our coworkers, but we have to treat them a little bit like strangers. We don't know if they have COVID or not, and we don't know if we have COVID and might give it to them. So it's really important right now that we're really, really vigilant. And so I really can't emphasize that enough. Another thing I wanted to bring up is I know a lot of you are working from home, and we really need to make it clear to you that working from home means you're here in Fresno in your home. If you're going to be leaving your home, going to another location, particularly outside of the county, that is not considered working from home. If you find yourself in a situation where you need to go care for a loved one or need to be outside the county and you expect to continue working, you will need to work with your supervisor to get division manager approval to do that. It's come to our attention that some people think that's okay, and we need to make it really clear that that's not okay. You have to have approval. That would be an exception that we would need to approve in order for you not to be working in the county. And the reason that is part of what's happening right now is we need to be able to rely on you coming into work if we need you to. And if you're not in the county, you can't really do that. And so we need to know that if you're not available to do that, that would be an exception and something you would need to get prior approval for. So just keep that in mind. And if you have any questions about any of the things I've talked about today that relate to worksite safety, COVID leave, or how long you have to stay off with COVID, please rely on the department's human resource staff. They have the information. They've collated the information from public health and our main HR, and they can get answers to your questions. We don't want people calling different departments and numbers and main HR and kind of going around our DBHHR, because we want to create consistency with the information. And so I'm asking staff and supervisors and all of our management team to please contact our department's human resource when you have a question. If we don't have an answer, then we can find one. What that really helps us do too, again, is make sure that there's consistent application of the information and make sure that the information being provided is consistent. I've had questions at different times. It seems like different divisions do things differently. And to prevent that, we need to make sure that we're all relying from the same answers. And if we're asking different people questions, we might get different answers and they won't all be accurate. And so we need to be consistent in that approach. Please use our main HR when you're asking those questions. Okay, I'm getting to my last slide, which is our question and answer session. And I'm going to look at my questions here. I'm not finding any questions right now, so I'm going to give a minute for, there's a slight tape delay here. So as I'm presenting and I look down at YouTube, which I have on my phone, it shows me any questions that we have, and I'm not seeing any questions on here. So I'll give it just another minute. And if I don't get any questions, then this was a quick one today, 20 minutes. Oh, here we go. Are the shields as effective as the masks? And what I'll say with that is no, the shields are not as effective as the masks. The way that a shield should be utilized is certainly if you're doing any sort of procedure medically or such where droplets could hit you in the face, and that we call those aerosolizing procedures, then the shield protects your eyes. Remember, your eyes have mucus, and that's one way the virus could get in. It usually gets in through your nose, or it could get in through your mouth if you're touching your face and you have virus on your fingers. The shield protects that, but it can't keep the virus droplets from coming underneath into your mouth. So in hospitals and such, sometimes they wear the mask and then the shield over, or they wear some glasses over. So the mask, when you see the mask being used in lieu, or the shield being used in lieu of a mask, it's not really an appropriate use of the shield. And so the shield just provides that extra protection. It's an extra layer. And then with the CDC adding new symptoms, is temperature still the main one we should be looking for? There are a number of symptoms, and not everyone who gets COVID has a temperature. Technically, my child didn't really have a temperature per the guidelines. And so that's how we know asymptomatic people can be going around, because they have no symptoms at all. And so as the CDC adds new symptoms, we're adding them to our checklist. And we are considering adding temperature checking to our routine checklist, but we're looking for a streamlined way of doing that. So you should anticipate that could be happening. And then I was asked if I've been tested. I have been tested once. That was a few weeks ago. I did it as part of surveillance testing, and I was negative. I took my test out at Sanger. I think I mentioned that in an email. And then coincidentally, later today, I intend to be tested as I'll be coming off quarantine. And we believe at this point that if I was going to get COVID from exposure to my child, that I would have enough virus to be testing positive if I have it. And so today or tomorrow, I'll end up getting tested, and we'll see, and I'll let you know. There was a question, how long after my child's exposure did he show symptoms? We don't know when he was exposed to COVID. And I mentioned this last week. This is a kid who had a mask, not necessarily following the rules. And so he believes there was multiple situations where he could have been exposed, either by a close friend or at an event he was at. And so we're not sure how long it was from the time he was exposed to COVID to the time that he developed symptoms. When he developed symptoms, in the preceding 48 hours is when I was exposed to him, which is a really high risk period of time for someone who does develop symptoms to be shedding the virus. So my exposure occurred prior to his symptom development that was of concern. And so that's the timeline for my quarantine. Does the CAO extending telework until 12/31 impact when we will begin coming into the office? The CAO's extension of telework is kind of a formality, we'll say. the much bigger factor that will be considered in bringing people back to work is safety. So really, and the need to have people in the office in order to meet the needs of the people we serve. And so right now, whether we had telework extended or not, we would be doing what we're doing, which is significantly limiting people coming into work still. Just because telework was extended till December 31st, if the situation changed dramatically, which I don't necessarily expect it to, we could consider bringing people back if we really got COVID under control, or a vaccine were developed or something like that. So it doesn't necessarily track with that. If someone gets tested more than once and they both tests come back positive, is that counted as one positive or two? In the statistics, someone who tests positive more than once, that it's only counted once. Someone who tests negative more than once, each negative test is counted. But if you test positive and then another positive, which kind of confirmed it, or the example I gave earlier, in the counts, it's only counted as once. And when you go on our website for public health and look at COVID, they have a really nice explanation under the testing area, which if you go on the website for public health to the COVID page, and in the middle it says epidemiological or something, you push that, that takes you to the statistics. And then at the top, it'll say additional surveillance or additional information. And you push on that, it has some testing information. And on that test graph, it will show you how the tests are counted. Will the White House's request to have COVID info bypass the CDC affect the accuracy and availability of statistics? No, right now, the way that the CDC was getting our information was through the state. So we have a state database called, I think it's called CalReady, that labs who get test results back report out through there. The county has access to it and can enter data into there. And then all of that goes up to the state. And through the state, it gets to the federal government. So the state really has control of the data. And where it goes after that is a little less of a concern, particularly with the accuracy of the data, because we can see the data internally through a state database, and then it goes to the state. So we're not too worried about that. Have I seen any good news regarding a vaccine? Well, you might have seen on the news that Moderna, and I don't know, that might not be the right way to say it, my apologies if I said it wrong, seems to be on the cutting, on the, we'll call it the bleeding edge of the vaccine development. And they're in that one of the later phases that I had mentioned a few times ago that vaccine development goes through, where they're testing on a lot, like a few hundred people are getting the vaccine. The early vaccine results with the smaller number of individuals showed that they had an antibody response, no significant negative impacts. And so they'll roll the vaccine out to a larger number of people where they can get different demographic and other factors in and see, you know, different ages, different sexes, different ethnicities and such respond differently. And so, you know, there's some hope, but you know, it's going to be a little bit like the testing situation. Once they have a vaccine, it's producing enough of the vaccine and then convincing people that the vaccine is safe. There's so much distrust right now of science and the government because all of this has become so political that there is some concern that people will reject the vaccine. They've done some polls and some people say, I'm not taking the vaccine. That will hurt our ability to get out of this situation if we have an effective vaccine and people refuse to take it. So this is something that's going to have to be watched really, really closely. So the vaccine, you know, it's still probably, we may have a vaccine that's been proven to work by the end of the year, but whether or not we'll have a vaccine that's in production and has enough dosages to really cover the whole United States is hard to say. I would anticipate, hopefully, that if a vaccine were developed, they would try and target areas that were really struggling or had had bad outbreaks first. But I don't know exactly how that would go. All right, I don't see any more questions. Hopefully we've answered most of the ones that you have. and look forward to seeing you next week. Again, if you have any questions in the interim, any concerns, please feel free to contact us via email, and I'm happy to answer those. Thank you.